Welcome to Ask Sid, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Sid, and as you can see, I'm back in Beverly Hills, our flagship location. And today I am so proud to introduce our medical director, Dr. Jason Chirichigno.
Oh, thank you so much.
Welcome, welcome, welcome to Sydenham. We are so thrilled to have you as part of our team. Thank you for leading this clinic.
I am so happy to be here. Honestly, Ansha, it's an honor and a privilege. And I'm here to get ready to get to work and really help build this clinic here in Beverly Hills. And really build on the fact that this community is already an incredibly healthy community. They're health conscious, they're health minded, they're always at the cutting edge of things, and we're just going to bring them to the next level.
We totally are going to bring it to the next level because Beverly Hills is where it all starts.
Exactly.
So everybody's very curious, like, who is the Sydenham Clinic medical director? Like, who is it? Like this, we've been trying to build this clinic for 2.5 years, right? So this curiosity remains in this whole city. And I now want to unveil what is Dr. Jason's next gig here at Sydenham all about.
Well, thank you so much. Like I said, I've spent, my career working as an internal medicine doctor in primary care, where for me, the foundation of all of this is the melding of relationships.
Right.
Old school with the future, with technology. All right. So I spent my career helping people really help understand and reshape what primary care is and how it's delivered, moving out of the old outdated method of, an old dark dreary office with these clipboards filling out forms where you wait an hour to see your doctor and then you get 7 to 10 minutes with them.
Oh, 7-minute medicine.
How do you accomplish anything in 7 to 10 minutes? And then the patient goes home, they get a bill, and then you don't see them for a year, okay?
Yeah. Or you see them when they're really sick.
That's the thing. We're going to talk a lot about this, the difference between proactive, preventive, precise medicine that we're going to practice here at Sydenham compared to sick care and, reactionary medicine. When people are sick, I'm not going to say when things are too late, but many times they are too late. And that's not what we're going to do. So I grew up in that world and I learned everything I could about internal medicine.
Tell us about your background. How was it like being in med school?
No, med school is fantastic. And I'm not gonna lie, a lot of people think it's really hard, and it was hard, but I loved it because this goes back, and I don't want to sound too cliche here. I grew up always wanting to be a doctor. I wanted to help people. And I just knew that moment, between a patient and a doctor, when a patient's at their most vulnerable, when they're sick, or even when they're just trying to get healthier, they want to start out on that journey. Because as you know, again, not too cliche, that first step is always the hardest in anything.
Absolutely.
Whether or not you're healthy or sick. And so they come to you and say, hey, I have things that I'm not happy with, or I'm not feeling well. And that's a very vulnerable moment, whether it be for women, whether it be for men, whether it be for children. So I grew up in that world, and I've done my best in that world and to deliver the highest quality care at the lowest quality cost. However, I've always been handcuffed, I felt, by the system.
Insurance.
Yes.
Big pharma.
It's all, and it's expectations, and it's, whether it be, private equity world and saying we need to make more money, and what that does is it takes time away from patients. So, we're going to go into depth in this, but what we're going to do here is invest time in you. We're going to invest technology in you. We're going to unleash the most advanced testing. We're going to talk so much about the heart, about the mind, about the gut, and what that can do to lay out the blueprint for your health. That's the other issue. When we think about populations in the insurance system, and the sick care system, it's cookie cutter. It's going to give you the same prescription as it gives me, as it gives our significant others, but that's the exact opposite of what we do here.
One size fits all.
And that's the last thing we need.
Right. So we're going to be doing a ton of podcasts together.
All right, I'm ready.
So today we're really going to talk about heart health, but my biggest question right now is, in 2025, should we be dropping dead?
That is a a really incredible question, you know, and I might get some flack for this, but I don't think anyone at this stage with the access and the resources we have should be dropping dead in 2025. Because we can, in many ways, given our technology, given the precision medicine now, predict the future.
Right.
And we're going to talk about the way we do that.
So why do people die?
Yeah, you know, when we think about death, we have to come back. And again, there are going to be other reasons, but we're going to focus today on the most critical.
Right.
Heart attacks, so your heart health, and strokes.
Right.
The two biggest things that are absolutely causing people to drop dead.
Now, we look at health from a very unique perspective. We have the 7 pillars of health, right? And I want to be able to share with people that if you don't want to die of a heart attack, you don't need to just go to your cardiologist, right? Your primary care physician has an equally important role to play in your heart health than just your cardiologist or your neurologist who you go to for your brain health, right?
I'm going to up you one.
Okay.
I'm going to say that your primary care doctor, and we have to talk about this too, we can cite statistics of what percentage of the US population actually has a primary care doctor.
Wow.
Starting with, the generation over 65, they did a good job, probably about, 30 to 40%. We come down to 45, it's down to 15 to 20%. We talk about 18 to 25, and it might be 2 to 5%. Okay.
Wow.
So we have so much work to do. And going back to your point about the cardiologist versus the primary care doctor, we love our cardiologists, and they're going to do amazing work for us if we need a procedure. But if you have a truly exceptional primary care doctor, the last thing you're going to need is a cardiologist, because we're going to invest the time, the resources, because we can see cardiologists have to go out and do those important procedures.
Right.
If someone, if a non-Sydenham patient who's been going through their life and not being aggressive, not being proactive, has to have a cardiac cath or have a stent placed or have open heart surgery, that's the incredible work that they're going to do, and they're going to save lives. Our job is to put them out of business from that perspective. We want all cardiologists to be preventative cardiologists in the future.
Yes.
So we're going to talk about how we do that.
Right.
We're going to talk about testing,
right,
whether it be lab testing, but not traditional lab testing.
No.
Starting with traditional lab testing, but then building upon it.
Right.
Imaging, not traditional imaging.
Right.
Building upon it. So open discussing all those things.
So your handcuffs are off now. So you can practice. You have like a dream practice now. You can practice medicine the way you like it. And how do you feel empowered here at Sydenham with those handcuffs off? Like, what are some of the things that physicians just take for granted?
Yeah, let's walk through a traditional scenario.
Okay.
And again, thank you for taking those handcuffs off. I feel truly blessed and privileged to be here. So let's use a traditional, someone comes in for an annual wellness exam. Traditional office, brick and mortar, it might not be 7 minutes. They'll do a little bit of extra work.
Right.
You'll have 15 to 20 minutes. All right. And so in that time, you need to try to slam in your history, your family's history, your lifestyle. And we're not even talking genetics or talking advanced tests.
No.
Just the simple things. And then we're going to get some lab work.
Right.
But you know what? There's always someone watching how many tests you order. Are those the correct tests? Quite frankly, you're going to get a few. You're going to get a lipid panel, so your cholesterol. We've all heard that term before.
Right.
You might get a metabolic panel. You might get a complete blood count. And then many practices will say, that's good enough. Plus or minus, maybe a few extra things if you're a certain age. Okay. Let's focus on heart health today. Traditional office, what I had to do for 15 years, we get that cholesterol panel back.
Right.
And I'm not saying this is your cholesterol, but let's throw out some numbers for you.
PP.
Your total cholesterol is 199. Your LDL, which is what we call the bad cholesterol, is 95. Let's just focus on those two numbers. Based upon your age, based upon your family history, in the traditional brick and mortar practice, I'm going to say, great job. Just keep going. We'll see you in 1 year. That's not what we're going to do here. Because guess what? Those numbers, even at 95, have been laying down plaque in your arteries since you were a toddler. When you go to medical school, you study these pictures in the books, and this is well known that the plaque, the fatty streak, starts forming as a toddler.
Wow.
Here we're going to step back. And yes, we want to know your baseline lipid panel, but we're going to add crucial additional things. And team, I apologize for using some medical jargon right now, but we're going to look at labs like LP little a. We're going to look at labs like ApoB, and that's just lab testing, right? When those labs come back, if they're at those numbers, you know what? we're going to design a plan to treat you aggressively, because we know that you're not going to have a heart attack now at 40 with those numbers, but if you continue with those numbers, you're going to have the heart attack at 60, and we're going to prevent that. Because we're going to take those out, then we're going to take a step further. You've heard of coronary calcium scoring?
Yes.
Slightly advanced imaging. You go in there, you come out, it's looking for calcified hard plaque. You get a score of 0, and you're jumping up and down in the traditional medicine world saying my risk of heart attack over the next 10 years is essentially 0. However, we can take it to the next level. We can do CT angiogram with an AI company called Clearly to add into that, almost as if you're having an angiogram. So we could see now the soft plaque, we could see how the blood is flowing through the vessels, and guess what? That coronary calcium score of 0 with no hard plaque is now putting you in a risk range of the 75th percentile because we see soft plaque. So let's treat that, all right? Maybe you don't want to get too aggressive right now. Let's start with lifestyle and maybe a statin.
Right.
But you know what? In your family history, grandpa, I'm not saying you, but maybe grandpa had a heart attack at 60, okay? Maybe an uncle had a heart attack at 57. We are going to stop that. Maybe we get aggressive. Repatha, a PCSK9. We're going to talk about genetics.
Right.
That is a crucial gene that not many people are talking about. Because guess what? In the traditional medical model, in the insurance world, you have to fail this and fail that, have aches on a statin, literally beg and plead to have this medication approved. Here we can just do it.
Right.
You're going to take the PCSK9 inhibitor, Repatha, and then guess what? Your LDL is going to be 15, 20. Guess who doesn't have a heart attack anymore? You.
And unheard of in the traditional medical system,
No.
right? I mean, you went to your doctor and said, hey, my LDL 17, they would be like falling off their chair.
Yeah, like, oh my God, you have the best genetics ever. No, I was able to
Right.
do this advanced testing and take this medication that was needed.
Great. Now let's dive right in.
Yeah.
Why we have this 7 pillars of health and why you look at every disease or the whole person from the lens of all these 7 pillars. So heart health and genetics, how they're related and how do you handle it differently here at Sydenham from a genomics point of view?
We cannot be doing precision medicine without genomics. And they are the future. They are the blueprint, okay? They are telling, doing genetic testing tells us essentially the future. It's a warning to the future and say, hey, when that test comes back and gives me very specific genes that we've talked about already,
Right.
PCSK9, ApoE4,
Right.
okay, it's just to name a few. If they're positive, essentially if you have multiple copies, we know you have an increased risk of heart disease. So why not address that? Okay?
Right.
We can't have that blueprint if we don't run the test. But once we have that blueprint, we can talk about even the simple things that we'll talk about later. Making sure you take 10,000 steps a day. Making sure you're eating the Mediterranean diet that's ultimately going to affect your gut microbiome, which is going to improve the way you process insulin. All these things, they're interconnected. You made a great point about the 7 pillars. Everything is interconnected. We cannot view them isolated as just a simple LDL test and, oh, things are great. So going back to your original
Does a
point.
traditional cardiologist even check your genetics or know your
And we
genome?
don't want to blame them because we grew up in a traditional medical model that says this is the path you follow, okay? These are all things that 30, 40, 50 years from now, I'm hoping will be done for everyone, but they're not right now. So we're going to be at that cutting edge. We're going to use these tests as the blueprint. We're not going to scare you as the patient. We're just going to say, hey, this is a real possibility based upon your genetics. Let's use this to our advantage.
Right.
Let's dig in on nutrition.
Yeah.
Let's dig in on lifestyle. We'll talk about all the 7 pillars.
Right. No.
We'll dig in on sleep. We'll dig in on stress. And then if we need them, the advanced medication.
You just have them in the background, giving you an overall guidance. Where
Exactly.
to go. The next one,
Yeah.
hormones. What's the relationship between hormones and heart health?
This is a fantastic one. And I love this because I want to talk about, an amazing section of the population that's ignored for way too long. Over 50% of the world, women.
Yes.
Let's use women as an example. And I'm so glad that women's health, particularly women's heart health, is finally getting the attention and the respect that it deserves. Money is finally pouring in.
Finally.
Not enough, but we're going to help push that along. So women's heart health, women's risk of cardiovascular disease, and hormones. I'll give you a little pop quiz. I know you're smart, but women's heart health before menopause, okay? Think about the risk of women's risk of heart attack versus a man's risk.
Right.
Who do you think has a higher risk before menopause?
I would think the older you are, your risk goes up,
Absolutely.
right?
Yeah. So let me kind of lay it out for you right now. Men and women, when you compare them, women prior to menopause have a significantly lower risk of heart disease than men. Women typically do not have heart attacks in their 20s, 30s, 40s.
Right.
Men can, and they do. All right. Then menopause comes, the shutting down of the body's own production of internal hormones, and then women's cardiovascular risk skyrockets. And in many cases, it passes that of men's. Why is that? Estrogen. Okay. And then we can step back, and for so long we think about the studies related to estrogen replacement, hormone replacement in relation to women. And again, we don't have to spend too much time on this, but some of the data...
It is something we should all be talking about, because there's a whole generation of women, my mother's age, my mother-in-law's age, were deprived of hormone therapy.
Exactly, and told to essentially suck it up.
Yeah.
And this is just what happens.
No.
Okay? It's not what should happen. We replace estrogen and we significantly decrease that cardiovascular risk. Of course, we're going to do it safely. Right. We're going to make sure we talk about your family history, right, of breast cancer or uterine cancer. We're going to make sure that there's nothing contraindicating the use of hormones, but for the vast majority of women, it's not. Okay. Yeah. So many studies showing that, hormone use within 10 years of menopause dramatically decreases heart disease risk, dramatically decreases Alzheimer's risk, we could talk for hours, but dramatically decreases.
Imagine going to your endocrinologist and talking about heart health.
Doesn't happen.
These conversations don't happen
We can facilitate them. Yeah. And that's going back to, we're going to continue to cultivate and curate an amazing group of specialists here in Beverly Hills, because there's amazing medicine here. Absolutely. And we're going to educate each other. And we're going to begin those conversations. Right. But for now, we're going to do a lot of that work here as well.
Well, I am excited to go forward and talk about our next pillar of health, which is gut health. And how is it related to heart health?
Yeah, when I think about gut health, I like the term, it's not the final frontier, but they're really in medicine. There's a few final frontiers. Things that hold so much information, so much data, so much stuff for us to uncrack still. Whether that be the brain, whether that be the immune system, okay? These are all things that are connected to the gut. And the gut microbiome.
Absolutely.
The gut microbiome is not just a collection of bacteria.
No.
Okay? It is an influencing, forming factor of your entire health. Let me tell you why. Go back to some really kind of basic science studies. I know we're talking with people right now, but we go back really scientific.
Please do.
There are studies, you take a mouse that's genetically overweight. You take another mouse who's genetically normal weight or even underweight, but healthy.
Right.
There's ways to transplant the gut microbiome from one to the other. That overweight mouse with a transplanted gut microbiome from the normal weight mouse is now regular weight. So there are so many factors. There are gut factors, there are brain factors that can change your metabolism, can change your ability to digest foods, can change your mood essentially. Because think about that.
Yeah.
It's influenced. The second largest collection of things like neurons and serotonin is in the gut.
Yeah.
Along with other bacteria.
And all the neurotransmitters.
So this is, for me, another foundation. And we do incredible testing here that tells us, what is your gut microbiome made up of?
Right.
Has it been influenced by too many antibiotics? Excuse me. Has it been influenced by where you've grown up and the environment you've been exposed to? Toxicity. How can we then, through our incredible work with myself and the rest of the team and our incredible, molecular nutritionist, biologist, Heather, go in there, identify where we're missing, and then change that bacteria.
So you're not treating the gut in isolation. Heart health is so closely impacted by your gut that these conversations need to happen in your cardiologist's office.
Yeah, let's go back to the heart again and nutrition. Yeah,
nutrition is our next pillar.
We can figure out the fact that, yes, the Mediterranean diet tends to have amazing results. But what's actually happening? It's going in there, and those healthy foods are changing the gut microbiome, which allows your body to process foods better, which allows you to process cholesterol better, which increases insulin sensitivity, which it's all connected. That's the piece that everyone's missing. Yeah. This is all connected, and you can't just take them out in isolation. You have to think about them together.
Absolutely. So nutrition, of course, we've known for a long time, and you've seen the fads changing. Eggs raise your cholesterol and, these isolated cholesterol conversations. But now I think it's much broader, and it's overall inflammation and toxicity that we focus on, because the gut is just like really the gut is like this whole new segment that's not addressed in traditional medical
It's
offices.
not. And it's incredibly complex, but it's also in some ways incredibly simple. You know, think about the last time. I know you're a superstar. You don't get anxious very often, but like when someone's genuinely anxious, their gut is off, and they can't function, and they have to miss their meeting. And the classic thinking about a young child missing school because they have a stomach ache because they're anxious about something that we haven't talked about. That is the gut-brain connection that starts from when you're 4 years old.
Right.
You know, that we can now actually tease out and figure out for you.
Right. Which brings us to my next pillar, which is psychology, mental health, and the connection of stress to heart attacks.
I mean, I love this statement. You know, mental health is physical health is mental health. We have to stop thinking about these things separately. If someone is suffering from undiagnosed anxiety or depression, are they going to come in and see us? Probably not. Or if they do come in and see us and we're not picking it up, are they going to go ahead and follow up on these tests? Are they going to take their medications? Are they going to take the lifestyle recommendations? No. So I've found in my practice over the years, if we can identify these things earlier and treat those, whether that be through improving sleep, whether that be through improving relationships, building community. We could talk about this for hours.
Right.
You know, the fact that we've kind of broken up communities. We live separately now. We live our lives on our phones. Let's come together. Another piece of Sydenham that I'm incredibly excited about, you know, building a like-minded community where people can come here, not just to see me.
No.
They can hang out and talk to other members and build relationships, decrease anxiety. You know, the data on loneliness and mood, you know, if someone is lonely, it's as if they smoke a pack of cigarettes a day.
Wow.
That's the effect on heart health.
And loneliness is an epidemic. It truly is an epidemic, especially here in the United States. It's even bigger than anywhere else. And which is why, for those of you who haven't seen Sydenham, just go watch pictures of what our clinic looks like. We feel like a social club. We feel like an extension of your home. And what we do here is something called longevity happy hours, where we invite different doctors, we invite people from the community. And that's what we're trying to build is we want our space to not look medical. We want to lower their anxiety. We want them to have an easy, simple environment, to have a relationship with the physicians. We don't overload them with all this testing right up front. Like you peel the onion through the year, it's very simple.
And I guarantee you, you know, we will see results just from that alone before we even do any interventions, you know. And if you don't mind, you brought up a very important point that I really want to touch on, you know, thinking about, you know, traditional longevity, traditional wellness, and how people, and biohacking, how people go about things.
Oh, let's talk about that, because a lot of that sounds stressful to me. And what is it doing to your heart? Is that not causing anxiety? Will that not lead to you dropping dead?
No, you nailed it. You know, the concept, again, I want to applaud people for going out and thinking about wanting to be healthier, wanting to be more connected, wanting to have more data. The key is, are you overloading yourself? You know, can you process? Do we not have enough inputs already? Yes, let's get this data together. Let me process it for you and help interpret it for you. So
you have a whole team supporting.
That's the beauty of it. Yeah. Behind the scenes, helping it, then presenting it to me, and I can present it to you. Let's take that off your plate. You're right. You know, when you're getting 16 notifications in an hour about your heart rate variability, about how much you slept last night, about what your glucose is, that in itself is becoming this game that you can't beat.
No.
So let us.
And you're going to TikTok for advice, or you're following people who are trending in this biohacking space and they're not physicians.
Another important key. You know, we're going to talk more about that later, I'm sure. But, you know, again, I'm always want to give respect to people who want people to become healthier, but who don't have the credentials. You have to be incredibly careful.
Right.
You know, you spend a lifetime essentially becoming a physician.
Right.
You know, medical school, residency, you know, your first years in the clinic and striving to be better and better and just seeing more and more patients and learning every single time with that responsibility. And too much of the wellness world at the moment is being delivered by people who've never had that responsibility, who've never written a prescription, who have never had to see a patient actually have a poor outcome.
Right.
And you did everything right. So that's the difference.
So can we safely say just because you're biohacking and you're eating clean, you can still drop dead of a heart attack?
Absolutely. You know, an example comes to mind. I don't want to anger too many in the community. Thinking about a keto diet.
Right.
You know, for many people, It might help them feel a little bit better, lose some weight, but without that clearly test we talked about before,
Right.
what is it actually doing to your arteries, which are going to cause you to drop dead?
Right.
They're clogging them.
Right.
And that's just a known fact.
Which is why at Sydenham, we're constantly personalizing your diet and changing it through the year. We're changing it in response to different testing and outcomes.
Let's think about keto for
Yeah.
a second. Maybe you've heard you want to try it because we want to work with you.
Right.
But first, we're going to go ahead. We're going to get your genetics.
Right.
Oh, you know what? Those genes we were talking about before, ApoE4, PCSK9, you don't have you don't have the wrong copies of those. So you're not at super high risk. We've checked your LP(a). We've checked your ApoB. And guess what? They're low. So your risk of heart disease overall compared to the rest of the population is low. So you know what? You want to try keto for 3 months?
Right.
Just to reset, lose a few pounds and feel better? We're going to do it.
Right.
But then we're going to recheck your cholesterol and then get you back on some plant-based for a little while. So we can individualize things.
Supervision.
That's the
At
key.
Sydenham, you're under constant supervision.
Exactly.
Because your body changes. Your body changes through the year. It changes in response to what.
And it's going to need
Like
different
stressors you're
things at different times.
That's life, right? That is
Exactly.
life.
And again, we want to make things less complex.
Yeah.
You know, because in foundationally, health span and longevity is very simple.
Yeah. It is. It is.
Walking, eating, sleeping, communing.
Yeah. And we have integrated all the Blue Zone components, all the 9 factors into
Thank you for
Sydenham.
reminding me.
Right.
Like, if you go back and study the blue zones, just for people who might not know, the blue zones are places where people live exceptionally long. We're talking the highest concentration of centenarians, over 100.
Right.
And guess what? Their lives are not very complicated. In fact, they're less complicated. They live in strong communities where there's multiple generations helping each other. They sleep well. They eat simple. They eat clean. They build movement into their day and their work, not necessarily going to the most expensive HIIT class
Or a hyperbaric
or the
chamber,
nutrients
red
or-
light therapy.
They're all great, but still, they're not doing those things and they're living so much longer than us here in the US
Yeah.
because it's going back to simplicity. But the beauty of us is we can combine simplicity with technology, with the blueprint, and then the community
Right.
and the supervision.
Right. Yes. And I think that is the secret sauce. We've spoken about almost all our pillars. We've spoken about psychology. We did touch a little bit upon physiology when you said walking. We've touched upon hormones. We've touched upon gut health, nutrition. Now let's come to the best section in our podcast, because now we
Okay.
have like a revamped podcast.
I'm nervous. Okay.
We talk about hot or not
All right.
trends,
Okay.
right? And I'm going to quiz you on some of them.
All right. I'm ready.
And all you need to tell us if your opinion on those is.
Okay.
Okay. At-home genetic testing kits,
Okay.
hot or not?
Not. But I'll give you a little caveat.
Okay.
They might be cute. We want to learn about our ancestry. Okay. But it's really not actionable data. All right.
No.
We want to do true genetic testing.
Right.
Looking at your genetic profile so we can act on that for your health. But if you want to know where you're from, go for it. But not hot.
So, genomic-based primary care, hot or not?
Oh, I mean, it's the future. It is here now. Okay. It has to be done. And I would never say like you can't go to a primary care doctor, they don't do it. But if you want to be, if you want a blueprint,
Right.
if you want to figure out where things are going and how to best optimize your life, come with us here. We're going to do it. So
The Clotho gene,
HOTS, again, coming back to understanding genetics and your blueprint. That's the only way to, we need that data. HOTS.
great, yeah. The keto diet for heart health,
I think you know my feeling there, not.
no. Okay. Menopause and heart health,
Don't take this the wrong way, but hot, okay? For the reasons we talked about before. Women's health is critical. Women's health dictates the health of a society and a country. And we're finally giving it the attention it needs and deserves. And we're gonna decrease heart disease in women by A, understanding genomics, B, using hormones again.
wow.
I mean,
I can't believe
it's as simple as that.
Yes, I can't believe what was
And
happening.
then do all the other things.
Shocking, yeah.
Help women, support them in that stage with, through sleep and nutrition and all the things.
A lot of third world countries are still not having this conversation. At least we've started here, and I'm hoping that the message can trickle
We're going
down.
to try.
This is really an important message.
Hot. Yeah.
Okay, so wearable health trackers and heart health.
Okay, hot with the caveat. What we talked about before, the fact that we're overloading ourselves, we're stressing ourselves out. Come to Sydenham. We're going to give you, we're wearing it right now. We're going to do track, we're going to do wearables. We're going to track, okay?
Yeah.
But our team is going to interpret that data for you and help you act on it.
So don't do it all yourself.
Don't do it all
not
yourself.
Safe.
And again, we start simple, okay? We don't need 5 at once, okay? We're going to start with one area of your life that's the most important to you, and that might be sleep.
Right.
So we're going to start with the Oura Ring, or it actually might be glucose and how you respond to food. So then we'll do a continuous glucose monitor. Or it might be, blood pressure. Some of the new wearables can do blood pressure, just FDA approved. So we're going to keep our eye on it.
Absolutely.
But, yeah.
But that's the cool thing, that you don't have handcuffs anymore. You can prescribe whatever test you want. We pay for all the testing.
Apple Watch,
so you're not
whatever we need.
answerable to the patient. You don't have to take the permission. Can I order this test on you? Are you willing to pay for it? You don't have to ask the insurance companies for permission to do a CT scan versus, no, you will do an X-ray first.
Dream.
Right? So I'm concluding the hot or not section, but I would like to know personally, what is your one health tip for cardiovascular health?
Oh, amazing. And again, we talk so much about innovation and technology, and I think that's critical, but everything starts with the basics.
Right.
And I don't want to be cheesy right now, but it starts with the first step.
Right.
Walking. I want you, if you can now, I know some people have some disabilities,
right.
But if you can, taking steps is the simple best thing you can do for your physical health and your mental health. 10,000 steps a day, if you can do it. If not, we start small. If it's 2,000, do that for a month, then 3,000, then 4. We'll build it up together, but walking.
Because I know we focus a lot on muscles. Like everybody who comes to Sydenham gets on the in-body. We know muscle is the currency of aging. But very often we forget the role of cardiovascular exercise or walking on mental health, and then how it lowers stress and anxiety, and then heart health.
There are studies, 10-minute walks, at any point in the day can decrease, the risk of forming a future, diagnosis of depression, so many things.
Right.
And then you want to keep sticking on this kind of like nutrition, cardiovascular, and metabolism health. A 10-minute walk after a meal essentially is like injecting insulin. It literally can lower your blood glucose naturally.
Yeah. I mean, the effect of walking and exercise on mental health is, some of the studies even show it's as much as taking prescription meds for depression.
And listen, we're always going to, if we need medicines, we're going to use them, but if we don't, we're not going to use them.
Right. Or use them for a short while and then get off them.
Exactly.
Well, thank you so much. This has been a great first podcast together. But before we go, what is that one health trend that's super hot right now, which you feel is a nay?
Can I be personal here?
Absolutely.
Okay. My 14-year-old walked in a few days ago, and he was holding the newest, flashiest, advertised, marketed by superstars, great athletes, Celsius beverage. Okay. My son is 14. No one knows this, but that beverage contains 200 milligrams of caffeine. I've had numerous patients come into me and say, Dr. Jason, I'm having headaches. I'm anxious. I have the shakes. What's going on? Do I have a neurological condition? I'm like, do you drink caffeine? They're like, oh, no, not that much. I saw this amazing ad. My friends are drinking this new clean beverage called Celsius. It's got more caffeine than any beverage out there on the market. So I'm not drinking Celsius.
Okay.
And neither is my 14-year-old anymore.
It is not Sydenham approved. Well, thank you so much.
Thank you for having me.
No, this is a great
I'm so glad to be here.
And truly what we're trying to do is, really through this podcast, is get people to change their mindset. How we're consuming healthcare. You said you had handcuffs. I think patients have handcuffs too, because they only think there is one way to have a relationship with the provider. But I think in some ways we need to bring back that good old family physician model.
That's it. That's the starting piece.
That is the starting piece.
You combine that with access and technology, and you're going to live a very different life.
Absolutely. So I hope you question the way you're consuming healthcare, the way you're biohacking. We just want to have these conversations to empower you so that you can be the CEO of your health. Thank you so much. Remember, health is by choice, not by chance.